I'm Dr. Alan Pearson. I'm an optometrist, and I am giving this presentation as a representative of the new Eye Center for Children's Vision, Learning, and Technology. Common vision issues in children can be organized into one of the following categories. Eye health and optical issues are more structural in nature, whereas strabismus, amblyopia, orientation instability, binocular instability, visual information processing, and saccadic praxis are all issues that are more neurological or functional in nature. Functional means that the physical structure of the eyes and brain are mostly normal, but the neurological connections are undeveloped or damaged. And this leads to behavioral dysfunction, limitations in activities of daily living, or poor achievement. In Washington State, the Washington Board of Health reviewed the literature and concluded that among Washington State students, about 25% of these students have a vision issue that impacts their learning. That's over 250,000 students. Eye health issues impact less than 1%. Optical issues impact 15 to 30%. Strabismus, or eye turns, impact 3 to 4%. Amblyopia, or lazy eye, impacts 2 to 3%. And binocular instability impacts 5 to 16%. The other categories of orientation instability, visual information processing, and saccadic praxis are hard to estimate due to these being multifaceted, complex, individual, and interdisciplinary. Just too many variations. Many students can have multiple issues spread among many of these categories. The common vision issues impacting children can be divided into those conditions that are easier to screen for and those conditions that are hard to screen for. High optical issues, strabismus, and amblyopia should ideally be found and treatment started very early in a child's life in order to prevent needless vision loss. Ideally, these conditions are detected and treated before a child reaches kindergarten. Vision screenings often miss these conditions even when they are present. Therefore, every child deserves comprehensive eye exams by an eye doctor before a child reaches kindergarten. The U.S. Center for Disease Control recommends children's vision issues be looked at between newborn to 3 months, 6 months to 1 year, about 3 years old, and about 5 years old. The American Optometric Association recommends a comprehensive eye exam at 6 months, 3 years old, before first grade, and every 2 years thereafter. Optometrists participating in the Infant C program provide a comprehensive infant eye assessment between 6 and 12 months of age as a no-cost public service. The American Academy of Ophthalmology recommends vision screenings at newborn, infant, preschooler, and school age. But full comprehensive eye exams are recommended for any child with developmental, neurological, learning, or other health issues. Bright Future guidelines for pediatricians in their well child visits include up to 20 vision risk assessments and vision screenings between birth and 15 years of age. More than 14 of those well child visits include a look at vision before the child gets to kindergarten. Clearly, by kindergarten, a child should have had at least 12 well child pediatric visits that could have screened for vision issues. If parents followed AOA guidelines, they should have completed 3 comprehensive eye exams. Therefore, high refractive errors, strabismus, and amblyopia should already have been detected and treatment initiated. Orientation and stability concerns should be addressed in early intervention when needed. This leads to the conclusion that if high refractive error, strabismus, or amblyopia is first detected in a school-based vision screening, it really represents a failure in our vision screening eye exam system in the birth to 5 range. During the school-age years, optical and refractive issues can emerge even if they are not a problem when younger. School-based vision screenings can help to find children that need eyeglasses. Binocular instability issues, like convergence insufficiency, emerge at school age because binocular instability is a difficulty establishing and maintaining single and clear vision in a sustained near-point vision task, such as reading. It is when children encounter the extensive vision demands in school that binocular instability becomes a problem. Binocular instability impacts 5 to 16% of Washington State students. Therefore, in addition to finding emerging eyeglass needs, school-based vision screenings should find emerging binocular instability problems too. Traditional visual acuity screenings at distance and near will not adequately detect refractive or optical conditions, strabismus, amblyopia, or binocular instability issues. Additional tools are needed over and above visual acuity screening tools alone. For refractive or optical conditions, visual acuity tests will miss farsightedness or hyperopia, which has a higher impact on learning. Visual acuity screenings alone does not often detect significant farsightedness. To find significant farsightedness, visual acuity testing has to be repeated while looking through a special lens, or a screening has to include an instrument-based device. For strabismus, a screening must include at least a test for 3D awareness or stereo vision, but even this kind of test can still miss some types of strabismus. Amblyopia most often impacts visual acuity. One eye has normal visual acuity and the other eye has reduced visual acuity. Amblyopia impacts both distance and near vision acuity. Traditional visual acuity screenings can detect amblyopia, but only in children that can call symbols on a chart. This usually means 3 years or older. For binocular instability, there is no adequate screening test because the issue involves difficulties in maintaining clear and single vision in a sustained vision task. Screenings are too short, so students can often do very well during the short screening test. But students with binocular instability will either have symptoms or an avoidance behavior pattern. Therefore, a symptom survey or behavioral observations from teachers and caregivers should raise a flag of concern and lead to a referral for a comprehensive eye exam. But any vision screening should really start with the question, have you ever had an eye exam by an eye doctor? If a school-aged child answers no, then the children is overdue for a comprehensive eye exam by an optometrist or ophthalmologist. There is no benefit in avoidance of a comprehensive eye exam by eye doctors, so all children should be encouraged to have a well-child eye exam regardless. There is no reason for vision screeners to be gatekeepers by communicating to parents that eye exams are unnecessary. Encourage all parents to get their child in for a well-child vision exam regardless of the results of a vision screening. For more information and resources about vision issues in children, visit www.educatingyoungeyes.org or www.wellchildvision.org. A full presentation on this topic is available at the School Resources tab of the educatingyoungeyes.org website. The presentation is titled Vision Issues Impacting Development and Learning, Birth to 5, presented by Dr. Alan Pearson at the 2018 Infant and Early Childhood Education Conference, May 3, 2018, in Tacoma, Washington.